First, I want to just say I'm really glad to be here, and we know how much you wanted to have this conference in Portland, Oregon this year. And since that, you had to settle on Atlanta, we worked really hard to bring Portland's best weather to Atlanta. So we're just really glad to be here with our weather. And I also just wanted to say to you, congratulations on 20 years.
So I'm going to ask Mark some questions that are things that I was curious about when I first met him. And I'm going to also open it to you guys. I mean, how often do you get a chance to ask the CEO of a healthcare solutions company, which includes a health insurance plan, questions you've always wanted to ask but never had the opportunity?
Uh-oh.
Now is the time. So let me just start by asking why you care about palliative care and why your company is aligned with that.
It's personal. It's personal. I've often, I won't go into the detail, but I'm the son of a physician, a family physician in Spokane, Washington. And I got to watch him practice medicine from, in the eyes of a child. I'd go on rounds with him after church on Sunday and worked in his office when I was a teenager. And I watched how he engaged with his patients. And the thing that when I think about it, is what was special about him was that he saw his patients. He saw them. They weren't just a vessel of injury or disease or something that needed to be fixed. They were living, breathing human beings with a story. And their families were along with that story. And he took the time to know them. And so often, he used to say, I'm not here to cure people, I'm here to heal them. And he understood that there was a difference. And so my own journey as an adult was, I often would run into physicians that didn't see me. And then when Epic came along, they really didn't see me. They were, and they thought their job was to cure, and that's it. And so, when we defined the future of our company, a legacy, 102-year-old company, but a legacy health plan, and said, that's like the old telephone. Good platform, had its day, did some good things. There's got to be a better platform that can really guide people from birth to completion of life in every aspect of their journey, in health and in sickness and back to health and the like. And so that's, for the last 17 years that I've been CEO, that we have been on that journey of transforming our company to be a catalyst to transform healthcare, to make it more person-focused and economically sustainable. And one of the ways that we thought about it was to take specific experiences, start with the patient experience and their family experience, and build back from there. Listen to people as opposed to assume we're smarter than them and that we know better what they need, and put them on the program and make them bend to, and I see that in healthcare all the time. I always feel like I'm subject to rules that I don't know until I trip over them, and then it's like, oh, we didn't tell you about that. It happens in hospitals, it happens in doctors' offices, it happens with health plans. So the idea was, we through personal experience saw and observed a gap in terms of how people with serious illness were being treated. And I think of it as, think of a picture of you and one of your patients, Diane. Like, just bring that to mind. And that's a sacred space when you are engaging with a patient and their family. There's a frame around the picture. And like, we go to an art gallery, your eyes are drawn to the picture. But one of the reasons that the picture draws you is because of the frame around it. One of the reasons that it protects the picture, it strengthens the experience of the picture, and you're not supposed to see the frame. But if it wasn't there, the picture would not work as well. So a company like ours, and I think frankly, hospitals, you name your player in healthcare, our job is to create the frame. Our job is to never get in the picture, because that's a sacred space for the patient, their family, and their physician, nurse, healthcare professional. And so when we thought about that, we said, what is one of the most poignant experiences in the picture? And that is people with serious illness, a disease that might kill you, or an injury. And how do we create a better frame around that? And it wasn't about that. The health plan might be a part of that frame, but the frame around that and what it would take was something much greater. And that's why when we looked at palliative care and the fact that so many people never got it when they needed it, we thought that was a good place to really go deep. And so we've been on that journey. Because we thought more broadly, it led us to the insight to start with philanthropy, strategic philanthropy, because what we noticed was that there was need for investment into workforce development, if you will, the supply side, and there was need for investment on the demand side, the consumer side, and where information and competence was lacking on both. And so, we're into it at this point in the high 30 millions of investment direct from the philanthropically. And after years of doing that and working with professionals in the field, you and your colleagues guided us to the notion of bringing the health plan to bear and creating a very unique way of reimbursing for it to help, once, in a sense, there was competence and programs, how do we provide acceleration for them? How do we provide support? And so the investment is probably at least triple that, just because of the engagement of the health plan. And then we've also brought to bear the investing arm of our company, which is about investing in new, innovative capabilities. And our goal is that every American who needs palliative care gets it.
Yes.
And gets it in wherever it's most meaningful to them, whether it's in the institution, and frankly, my dream, in the home, in the community, because that's where people spend most of their time healing. So that's how we got into it, and it has been quite a journey. And it is I've been so amazed by the people we've met along that journey, the people, many in this room.
Yeah.
Amazing.
What's interesting to me is, remember I was talking earlier about how I knew nothing about the business side of healthcare, and I knew nothing about social marketing, and I knew nothing about all the other sectors, like yours in healthcare, and I'm really grateful to learn and to understand that we are all in this together. And if we don't pull together towards the goal, we will not get there. Yeah. That, you exemplify that commitment to doing that.
A lot of people at our company.
Yes.
I mean, it's, as I said, everyone has a story.
Yeah.
And we tell those stories because that's what it keeps us focused on.
What
here,
matters.
Here. Yeah. Because I think that's what this journey is more about the heart than the head.
Yeah. So let me ask you, I wasn't there, but I heard from many people that you were at the CTAC meeting last year, not this year, but last year, and made an impassioned plea for better public awareness to drive demand for palliative care. And I want to understand why you think that's important.
Because the work that all of you do in this room and that you have pioneered, too few people know about it and understand it. And my respectful observation is, with the exception of you and some others that we've gotten to know in this, I think many in the profession have not quite known how to find their voice and be fierce about the importance of the work that you do on a clear, consistent message, and so that individuals and families know about palliative care, they know what it means, and most importantly, aren't misunderstanding it. And your research shows that there's still a lot of either lack of understanding or misunderstanding at both at the individual and family level and even at the physician level. And that has to change. And it can't be done by one sort of single organization. The reason I chose CTAC to give that plea was because CTAC is kind of an umbrella of many organizations that work in this field.
Right.
And it just is, the inside the Beltway organization that has the mantle. And I felt like it needed to take that mantle because I didn't think it really was. And I thought, they'll probably never invite me back. And I didn't care. I decided to model fierceness in the way that I spoke, and I didn't know when I got on stage exactly what would come out of my mouth, but I knew what the general message was going to be. Yeah. And the irony of it is me and my big mouth, they ended up asking me to join their board to help them do it. And so it has been fun over the last 6-7 months helping craft the moonshot that was announced this year. And the only thing I think we really got wrong in that was we probably aimed a little too low, and God bless you, I heard that you said 6 million? Bah! It needs to be higher. And so the board has revised that to 12. We listened. But my own personal aspirations is a lot more than that. Yeah. And I think we can do it. But it starts with clarity in a room like this about who you are and what essentially you stand for.
So I've evolved to thinking about utilization actually as a quality measure for patients and families, because everybody pays co-pays and deductibles, and a huge amount of what people get when they come to an ED or a hospital is bills that they are now accountable for, because we're shifting the risk to patients and families as well as clinicians. And so, and also, who wants to hang out in the ER for 24 hours, and who wants to be in a hospital? Nobody, right? So the burden of that utilization, even though we think about it as cost to the hospital or cost to the payer, is actually on the patient and the family. And so I think we should use that as a quality measure from the standpoint of the patient and the family. If somebody can get their question answered through telemedicine, or they can get someone to come to their home to evaluate them after a fall, that is an outcome measure that's really important for patients and families, and it saves them money and time.
I've only encountered one time in my entire life, other than my dad's example, that where I saw palliative care applied right off the bat, right alongside curative care. Every other time, it's come in kind of late in the game, and frankly too late. With my parents, their journeys through their rare diseases would have been so much easier if there had been palliative care right alongside the curative care. And I wish it had happened, but the one time I saw it was this summer. My older brother suffered a terrible accident, fell downstairs head first, was very, very seriously injured, and I spent 9 days in an ICU in distant Los Angeles. But what a special place that was, right in the middle of the war zone in Los Angeles, where the Crips and the Bloods do their battle every day. And this hospital sits there, And the trauma team is amazing, but what makes it amazing is the person who leads the trauma team, a guy named Dr. Gaudata Hineka. And he is the first person in my adult life that I've seen who, as a incredible trauma surgeon, and knowing what his job is, applies, and in my observation over 9 intensive days, he has created a culture on that trauma team that understands that palliative care and curative care, even in that grave, we're just trying to keep him alive, we're just trying to, that it belongs there. And it made such a difference in my brother's arc of his recovery. And I know, and this was surprising to me, I've talked about it, but I'd never experienced it, what a difference it made for me as his primary family caregiver, and for my brother and one of my sisters who were down with me during that time. It was, because we were hurting, we were scared, and we weren't getting much sleep. But their care, spiritually, of us was unbelievable and totally unlooked for. That's the way it should be all the time.
Right.
You are the ones that should define this. And you need to decide. But that's work for you to do.
Yep.
And you have to be fierce about, even within your institutions, to coax them and say, it isn't all about what happens inside these walls. Yep. And I think you've got more receptivity, because I think a lot of health systems are really understanding, at least the more enlightened ones, is it's like, it isn't all about what goes on inside the walls, and they better get out in the community or they're going to be irrelevant. I love going by institutions, healthcare institutions with the big cranes, and there seems like everyone has one, and I just think to myself, I hope you have a plan B hotel strategy, because you're going to have a lot of empty beds, because more and more capability for people to get care in the home, and that's where they would rather have it. And that's where the opportunity is. But you have to figure out how to bring your message to that. And then I think health insurance companies will respond to that. Now, I'm not letting that part of the industry off the hook either. And I'm advocating inside. And I think there is more enlightenment. But I think I would say you have the greatest ability to help drive that. I think hope brought you into this profession. I really believe that. I've just met too many of you and interacted and seen that I think you are people that are filled with hope. I think that hope needs to be directed to really believing that you are the future mainstream of healthcare. And if you have that kind of hope that just compels you to act, and that's where I hope you will be in that space, that it creates a fierceness in you that says, this is what people need. And I'm not going to say that someone else needs to change before I can get there. My hospital administration needs to change. The health insurance industry needs to change. Government needs to pass a law. I think each and every one of you can be an incredible force of change. And you have to have incredible courage, individually and collectively. And you have to put it all on the line. You have to be willing to say, this is so important that I don't want my career to end with so many Americans still not having access to palliative care upon diagnosis.
We're done.